DrRic, and I'm going to talk about going on a hike at altitude and what you shouldn't be doing when you first get to your destination. So those of you who follow me or know me as patients on my YouTube channel or Facebook, I run a DrRic hiking excursion that I take people on cool kick-ass adventures once or twice a year. And it's nice to have a destination so that you will invest in exercising and building up to that goal. That usually means that as you approach, say, August, you'll start training and be invested without any excuses from 4 months prior. I think that's usually what happens with New Year's resolutions is people kind of tap out after about 2 weeks because the motivation is low and the goal is not set or it's too far-fetched. And it's important to have goals. And not to deviate too much from my video, that's why I set these excursions, is to give people summits to work to. We are now in Bryce Canyon in Utah, which the elevation here is about 8,000 feet. So going from Chicago, sea level somewhat, to 8,000 feet in one day or 4 hours. We actually we flew in from Chicago to Las Vegas, drove 4 hours, and we got here. A couple of rules that I tell my patients. I mean, it's good to always train, but it also is important to figure out with your cardiovascular endurance that you build up, are you going to be good enough when we get to altitude? So the definition of acute mountain sickness is the idea that your oxygen is not going to be as plentiful when you get to high altitude. The partial pressure of oxygen is lower, so even if you're an athlete, if you haven't acclimatized to the higher altitude, you're going to be sucking in more air, breathing faster, because the lungs, the brain, all the tissues of your muscles are asking for the usual oxygen delivery that they're used to at sea level. And when there's not as much oxygen, it's going to make you reflexly have a faster heart rate and a faster respiratory rate. So one of the first rules is try to acclimatize. And that usually takes about 2 to 3 days. And not that many people have 2 or 3 days to just sit around in the hotel and just do activities of daily living. You're not supposed to exercise. We're already in our 3rd day, and I'm starting now because I don't have any symptoms. And I've been to altitude a couple times, mostly 10,000 to 14,000 feet. So it is important to be aware of what the symptoms are. So it can be fatigue, difficulty with sleeping, shortness of breath, peeing frequently, headache, or just irritability. All those symptoms sound general. In fact, a lot of patients that I took on my excursion here in Bryce Canyon are having a little bit of difficulty with sleeping. It could be blamed on the mattress. It could be blamed on the change in going from working to vacation time, and the sleep is off. We are 1 or 2 hours delayed from Chicago. It's really weird the way you pass from Arizona to Utah and you are plus 1 hour or minus 1 hour. But the objective is to be aware of those symptoms. Now I can keep an eye on my excursion team. I can see who is struggling. I can pay more attention to them. I can even be a Sherpa if I have to, carry their backpack so that they can make it to finish the hike. But sometimes people will say, I'm on vacation, I want to exercise because I'm a marathoner. Or I'm on vacation, I can have a drink. You shouldn't be doing that in the first 1 to 2 days. Let yourself get acclimatized. Well, actually, just let yourself get used to the altitude and see how you feel. If you have symptoms, technically you shouldn't be exerting yourself. And that's a tough call, because again, most people have a little bit of a headache and a little bit of a problem with sleeping. So I'm not going to tell my patients that have those symptoms, everybody has to stay back at the hotel. You can't hike with me or go to a destination, because typically our destinations will have to call on a change in altitude, slight, that's an elevation change, even at this level. So at 8,000 feet, the elevation gain when we take on a trail can be 200 to 1,000 feet. And even that, added onto the 8,000 that you're getting used to, can put you into worse symptoms. AMS, acute mountain sickness, can advance to HAPE or HACE, as pulmonary edema and cerebral edema. We don't have to talk about that here. You can probably find videos online, but we do not want to get to that point. The chances of death are high, even if you're an athlete. And some papers show that the athletes are a higher chance for that. Maybe that's because they think they're bulletproof, or they're training for something, or they like to exercise because it helps them sleep more. So I would usually say no alcohol, please. And definitely, if you can hold off on exercise for the first 2 days, just to see. And I know I'm going to take you on an excursion and make you work on the trail with your backpacks and with just hiking sticks and walking or ascending. But adding on any kind of muscle building exercise or running, even if running is healthy and exercising with resistance is healthy, I'd still say take it easy for about a day or two. Now, this is a little complicated because our trip is only technically 3 days. So resting a day or two, people are gonna feel gypped with spending their vacation, paying all the money that they paid, and then not being able to do anything for the first 1 or 2 days. So again, it has to be individually, like any medical disease or any medical evaluation, it always has to be personally designed. I don't make everybody just hang out at the hotel. So a couple things. When you do, during the when you acclimatize, you will be breathing faster. Your heart rate will be faster and you'll probably pee more. Those are the symptoms that usually help to figure out that you are getting better, when those things decrease. I can keep an eye on people. If you have medical disease, you always want to take care of that first before you get to destination, which is why I give people 4 months leeway to train. I can keep an eye on my hikers while we're in training in Chicago, and then I can kind of get a feeling for who I have to keep eye on closer or pay attention to closer. So I'll have some stubborn hikers that won't want me to intervene, and that's honorable. But in some cases, even if I have to be the guy that carries the extra backpack while we make the ascent, it's okay. It's not a declaration that you're weak. It's just that we want to decrease the workload. So let's talk about treatment. Treatment can be, if you have issues with going to altitude, having all those symptoms, hopefully you didn't have HAPE or HACE, but sometimes treatment is to optimize your medical disease and your medicines, but also acetazolamide, which is a carbonic anhydrase inhibitor, taken 250 milligrams. Actually, it's 125 to 250 twice a day for a couple of days before. I've done a video on that and ginkgo biloba. That will help you acclimatize to higher altitude. Now that's a sulfa kind of drug, so if you have a sulfa allergy, it's a no-no. The other thing to consider is hydration. If you're dehydrated, it's not good. So people who kind of push back their hydration because they don't want to pee during work, don't do that when you're at altitude. You'll usually hear that it's important to drink a lot. That's usually because the response to altitude change going higher is fast heart rate, fast breathing, and peeing. It's just an antidiuretic hormone activity that happens to compensate for the metabolic alkalosis that happens when you breathe faster, and that's too much into the weeds. But yes, drinking is important. I just did a video on boxing on noon, so check it out. I'll put the link down below. But again, it's important to maintain that, push it further, especially if it's hot out. in this condition here in April, it's about 20 to 40 degrees. And the sun is out, but it's so unpredictable here. So that's the problem with going. If you want to avoid the crowds at Bryce or Utah, you go about April or September when there's no crowds, but the weather pattern, you'll have to take 2 suitcases, one for cold weather, one for warm weather, or you just layer, but it's a pain in the ass. Anyway, it's all made up for when you go see the vistas that we go to. So, second, if you do have a history of headaches, or if you use an inhaler, it's okay to take your inhalers. It's okay to take Advil, as long as you don't have a reflux issue or ulcers. Maybe Tylenol to take care of the headache. Like I had a trigger point that always affects me. So sometimes it's a tough call to say, is it the AMS or is it my usual headache? And if you take that Tylenol and it goes away, cool. But that sometimes makes it confusing for me to figure out, okay, does this patient or hiker, is he putting a Band-Aid on AMS, or is it just a standard headache because their sleep is off? Hard to say. But again, that's why it's personal, personally designed evaluation, personally designed treatment, personally designed training. So as far as eating, here there's a huge breakfast buffet, but there isn't any lunch usually available except for fast food. Or what I do with my hikers is we stop at Whole Foods wherever we are. This time we stopped at the Whole Foods in Las Vegas, right outside the airport, stocked up on stuff to keep in the room just in case you can't go out. But the other meal that's available locally is dinner. But dinner typically, you gotta get in line, and I don't suggest overfilling. And typically when you're training for altitude or any kind of exertion, it should be carbohydrate, and those of you who follow me know that I'm a little bit on the protein carnivore side at this point in time. So I have to break that because I know carbohydrates supply what I'm burning up the night before, so they re-energize the battery, the so-called battery. And if you do store up your carbohydrates in the glucose, glucose can be changed into glycogen. Glycogen is stored in the liver, and in the muscle. But you can typically burn that off in about, the worst case scenario, 4 hours. After that, if you're not fat adapted, you'll start breaking down protein as a fuel source. That's gluconeogenesis. And you don't want to break down protein, whether you're at altitude or whether you're training for some other event or just trying to get ripped. So I usually suggest try to lean more into healthy carbohydrates, not processed carbs. So that's one thing. As far as sleep aids, tough call, because sleep aids will get you to sleep depending on what you use. But if you're using like benzodiazepines, Xanax, clonazepam, those are actually they depress the breathing apparatus, so they make you breathe slower. And again, the reflex rescue for AMS is to breathe faster. So in a nutshell, when you're going at high altitude, less partial pressure of oxygen, you have to breathe more because you have to get more oxygen per breath. Use parts of your diaphragm and lung that haven't used at altitude or at sea level. And if you start to decrease that response with alcohol or benzodiazepines, sometimes muscle relaxers or pain control medicines, you're ripping off your Band-Aid. So I would try as much as possible not to use those things. And again, that's counterintuitive because after a tough hike, everybody's sore, so they'll go for a muscle relaxer. Everybody's having difficulty with sleeping, so they'll go with a sleep aid. So just take it easy. I always go with supplements, sleep aids, L-theanine, melatonin, magnesium L-threonate, muscle relaxers, magnesium, topicals. Sometimes we'll go into other supplements, but that's it for another lecture. So bottom line is, even if you're an athlete, whoever you are, if you're going up to altitude, it's always better to wait a day or two, not have any alcohol. And alcohol does take care of headaches, but it screws up sleep, makes you pee off, and I explained all that stuff already. And always be cognizant for people around you. The easiest rescue, truthfully, if you're going up to altitude, is to train high, sleep low. So even if you drop 1,000 feet, say we're at 8,000 feet here, if I had somebody that was really in distress, having problems, I might want to drive them back to Las Vegas and have them sleep lower, but I don't know if I would do that. It's too hard to leave the rest of the group to drive one person. So, and that's why it's important to realize, be in close contact with your doctor. If your doctor can help you prep for your high altitude excursion, that'd be great. If your doctor doesn't know anything about AMS, seek out a doctor that does. Or you can subscribe to me and become my patient. Technically, if you're outside of the state of Illinois, I coach you. I can't be your patient, or we can't have a doctor-patient relationship outside of Illinois because I don't have a license in other states. But coaching will be just as good, honestly. I just can't prescribe it. I don't usually have to. I can use supplements, I can use therapies, I can use lifestyle changes to help you get to the destination. And all this stuff to bring it right around is all for longevity. If you look at the blue zones, one of the characteristics of the blue zones is to eat whole food, mostly plant-based, to walk a lot, to be engaged with your family and younger generations, and have a sense of purpose. So in addition to spirituality, those are the things for the blue zone that I think get you to longevity. And I think that having a goal like an excursion and keeping it safe will also get you there faster. So thanks for watching up to this point in time. If you've done anything or had any symptoms where you've gone on an excursion or gone on high altitude and you had problems, I'd like to hear the stories, and I'm sure other people would too. Otherwise, consider coming out to one of my excursions. Get out to nature. It's a great way to spiritually reconnect with your ground again, kind of like a unplugging detox from all the crap that's happening in the world. And stay healthy, please. See you at the next video.